Hello, everyone, and welcome to week 2 of DTLC season 13. Wherever you are joining us from, thank you for being part of this journey to gain mastery over diabetes. We are delighted to have you with us and appreciate the commitment you've already shown by registering, joining the community, and engaging with the program. Before we begin, I would like to thank you all for the wonderful participation we have seen in the WhatsApp group. We have received many questions and comments as well as in our YouTube channel. We truly appreciate. This actually tells us that you people are eager to learn, to take control of your health. We encourage you to continue asking these questions, but we also ask you for patience. Over the next several weeks, we will be covering key aspects of diabetes management in detail, including 6 dedicated nutrition sessions. Many of your questions will actually be addressed as we progress over the program. Well, here's an important diabetes fact. Studies actually show that 2 people can have the same diabetes diagnosis, but very different health outcomes. The difference is often how well they monitor and manage their numbers over the time. Diabetes is a condition that requires more than just taking medication. It requires understanding your body, monitoring your health, and making informed decisions every day. The more you know about your health, the more empowered you become to prevent complications and improve your quality of life. Well, the objective of today's session is to help you understand the key indicators that every person living with diabetes should monitor, what the numbers mean, and how these numbers can guide better health decisions. By the end of this session, we hope you will be more confident in tracking your health and knowing when action is needed. So joining us today is Ms. Jalang'o, Diabetes Care Specialist, who will be sharing her expertise and practical insights with us. We are also joined by Ms. Yvonne Kiarie, a continuous glucose monitoring, in short, CGM specialist, a technology that allows people with diabetes to track their numbers. Our focus today is simple but extremely important: monitoring your health and knowing your numbers. Remember, what gets measured gets managed. So when you know your numbers, you're better equipped to make a decision. Thank you once again for joining us, and let's get started. So before we move to the heart of today's discussion, we'll take a few minutes to reflect on what we discussed last week. Our week 1 topic was your why and toxic habits. We explored the importance of identifying the deeper reasons behind our desire for change and recognizing the habits that may be standing in the way of better health. As part of the challenge, last week challenge, we asked each one of you to write a powerful why statement and identify toxic habits you would like to overcome. We hope that you took the time to do this. Probably even put your thoughts down on paper. Well, one important point that we emphasized was your why. Well, this is a statement. It's almost the same as a goal, but it's actually very different from an outcome. For example, if you say, I want to reduce medication, I want better blood sugar control, or I want to put my diabetes into remission, these are wonderful outcomes, but they are not your why. Your why actually goes a little bit deeper. It speaks to the person you want to become, your daily actions, and the values that drive you. So your why is what keeps you going when motivation fades. And today, we would love to hear from you. What is your why? Did you get to identify your toxic habit? 1, 2, 3? Would like to hear. So feel free to share your reflections with us in the chat. Feel free to unmute and just speak up. We would love to hear from you. So this is your chance. Did you do something regarding the challenge of the week? All right, we have unmuted, so feel free to write on the chat, to unmute and say something. Yeah. All right. So probably before you arrange your thoughts and you bring your notes, maybe I can actually go first. I can tell you my why. Well, I've been in the DTLC program for 7 seasons now. I've worked with different people living with diabetes, living with other conditions. And my why has always been the desire to take better care of the body that I have been given by our Creator Jehovah. This has kept me motivated season after season. So, what is your why? A simple question for you. Dr. Jalang'o, Yvonne, Felix, do you have a personal why that goes beyond the outcome?
Yes. For me, it's the delight that I gain when I see that in things like diabetes care, it's not just about the medicine. How lifestyle can really impact and change one's direction in terms of diabetes management and then in the long term warding off complication. That is why I stay committed to this to DTLC to be able to make that little difference one life at a time.
Yeah. Wow. That's a strong one. When the motivation fades, that's what we remember. Yeah. Abby says, my why is resisting snacking. Feels a little bit like an outcome. Why do you want to resist that snacking, Abby? That is your why.
Well, I think I can also chime in and
Okay.
tell you about my why. Hi, everyone. My name is Yvonne. So, for me, working in terms of helping people be better at glucose monitoring is because we realize that somebody living with diabetes really thinks about their sugar multiple times of the day, and they are always wondering whether if there's something going wrong with that. So, is it high? Is it low? Is it okay? And they make that decision so many times, like, should I eat, should I inject, should I drive, can I do this? So just to avoid people having that anxiety and feeling more in control of the situation, when I see patients feeling happy and confident to manage their sugars well because they know what's going on and they feel in control, that really keeps me motivated, yeah, to keep doing this.
All right. Thank you so much. Yeah. Anybody else who wants to give it a try? You can also feel free to write on the WhatsApp group. All right then. Well, feel free to type in the chat. We'll read them as we continue. So thank you, Abby, for sharing that with us. You still have some homework to do. Why do you want to stop snacking? So we look forward to hearing that from you. Now it's time to dive into the heart of today's session, monitoring your health and knowing your numbers. Well, today we take the next step by learning how to measure progress and monitor the indicators that can help us stay on track. To guide us through this important topic, I'm delighted to welcome Ms. Jalang'o. Not a very strange face. We know this. We know the doctor, our diabetes care specialist. So, Ms. Jalang'o, thank you for being with us here today, and we are eager to hear from you. Welcome.
Yeah, good evening, everyone. Thank you so much, Lydia. It's a pleasure to be here once again. And today I'll take you through something that's really important for your diabetes journey. That is knowing the numbers. The numbers tell a story, and a very important story that often you cannot ignore. Now, I'll start first by sharing the numbers that you gave us. Thank you, Lydia, for compiling this up so that we can learn from it. Okay, let me remove all this. Yes, this is better. Yeah. Yeah, so thank you for sharing your data. So when for the participants of DTLC 13, the majority, over 3/4 of you are living with diabetes, you know. So this is very, very relevant to us, okay? So just about 7% of you are not living with diabetes, but remember the information that we share here, the bulk of it can help you ward off diabetes. Then over a half of you have had diabetes for at least 6 years or more. So I think it is very meaningful to us that this session is extremely relevant to whoever is attending. Then we've seen the HbA1c. This is your long-term blood glucose control. It ranges from 6, which is really, really good, 7, that's great. And then we go as far as 19. Ideally, HbA1c should be below 7. Then in terms of medication, this is the variety of medication that is being used by the participants who gracefully participated in that simple survey that we shared. So you can see it ranges from metformin, glucomet are the same, Biophage is still also metformin, then Vidasmet, glibenclamide, and also you can see all the way to also some antihypertensives being used by some people in the group. This will become relevant when we work on your medications later on. Now, today I will focus on monitoring, knowing your numbers. So I will work a lot of figuratively relating your diabetes journey to going on a journey. Imagine that you've been invited somewhere 10,000 kilometers away and you're driving a car, okay? So you are the driver and you are going on a 10,000 kilometer journey self-drive. So managing diabetes is, I would liken it to going on a self-drive, a long self-drive, because more often than not, the diagnosis of diabetes is a lifelong commitment. You're the driver, your destination is healthy living. Your dashboard, you know, you've seen the dashboard which tells you the kilometers that you have covered. It also gives you your speed. And then the other thing that's usually on the dashboards are the warning lights. So the dashboard is your glucose readings and the other numbers that relate to your diabetes management. Then the road conditions reflect your daily life. You know, the things that make life, you know, life happens, the stress, the illnesses, the relationship issues that you have, the exams, you know, if you are a student, the office politics, you know, because all those things affect your diabetes management. So just like you would not drive without checking your fuel or dashboard, you cannot manage diabetes safely without monitoring your numbers. So monitoring is not about just blood glucose. It includes your blood pressure. It includes your weight. It includes cholesterol, your sleep, your mood, your mental health, your food, and then your organs. You see? So you will need to check your eyes. You will need to have your teeth checked. You'll need to have your feet checked, your kidneys, your liver, and even your gut. You know, what do you leave in the toilet? How does it look like? That can be a pointer to a problem in your gut. Okay? So it is important that you monitor. When you start the journey, when we refer to the driving case, you check your fuel level before leaving. So what is the diabetes connection here? Do you check your blood glucose before making any decisions in your self-care? Then when you check the dashboard, you check whether there's fuel. Is it enough? Is it finishing? What speed am I going? So are you monitoring the sugar levels on a continuous basis as you go about life? Now, the dashboard can give you warning lights. Normally, if you ignore them, the car can run up into problems. So when you monitor your blood glucose, and especially if you have the resources to monitor it on a daily basis, then you can see the highs and the low readings. And these readings, just the way you are not supposed to ignore the warning lights on your dashboard, you need to act on your high and low reading. So we want to maintain your blood glucose control between 4 to 10, or usually 3.9 to 10, you know, if you're in good control. And if you're in tight control, you can bring that down to 3.9 to 8 millimoles, okay? Now, the road conditions, this can damage your car, you know. What do you do when the road changes, you know? So when we look at the diabetes connection, it's how do you adjust for stress? How do you adjust for illness? How do you adjust for your meals when you're eating particular meals? And especially when you're not at home, it's because you have to keep a tab on that, because this will impact your numbers, you know? Now, when you're driving, you plan your route, you see? With your life as somebody living with diabetes, do you plan your meals, your activity, your sleep, your medication, when to take them, what to do, what not to do, you know? Then the other important part of your morning monitoring is navigation support, you see? Normally, we would ask GPS to give us the direction, or sometimes you can stop and ask on the road. Maybe you stop at a police check and ask for the road. Now, for you, when you have diabetes, do you consult your care team? When you are unsure, when your results show you something you are not sure what to do you consult? So follow-up is a critical part of monitoring, you know? Now, the last part of your journey is normally reaching your destination. What ensures your safe arrival? So how does this relate to diabetes? Now, we know that when we know our numbers, when you know your blood glucose, you know the cholesterol level, you know you've done your liver is functioning well, you've done your kidney test, your kidney is functioning well or not, you know. Now, these numbers help you keep things in check, you see, because we will give you a range. For blood glucose, you want to maintain the range between 3.9 to 10. For HbA1c, you want to keep it below 7%. If it's your blood pressure, you know, you're looking at keeping it between 90/60 to 130/80. if it is your weight, you calculate what is referred to as your BMI, your body mass index. You see, body mass index can be calculated by your weight in kilogram. You divide it by your height in meters squared. It will give you a number, okay? So that number is maybe 20 kilograms per meter squared. You see, so it tells you how much weight you are carrying per meter squared of your body frame. If it is too much, I can tell you it will impact your blood glucose, and it will impact your blood pressure as well, and can also predispose you, make you at risk of other complications of diabetes. So monitoring helps you keep in track. So whatever it is that you're monitoring, whether it's your lipids, there's a level that is required, whether it is your blood glucose, there's a level that is required, and it is important to know the target ranges, okay? For the blood sugar and blood pressure, we normally have a set target range that tends to work for most people, Now, things like body mass index may vary from person to person, and even in some cases, you will find in older people, the target range for blood sugar may be different from the rest of the people, or in people who have certain complications, like somebody who's had a heart attack. We don't want their sugars going too low, or somebody who's had a stroke, or as well as somebody who is very old, because we don't want the risk of hypoglycemia. However, more often than not, please do not share your targets with somebody else, because for some of the parameters, not one size fits all, so they are personalized. So when you go to a clinic, what you should be asking when at a visit, you always ask, how do my numbers compare to the recommended levels? Yeah, okay? So it's important to know how your numbers compare to the recommended levels. Monitoring is about data. Data is information. And why is monitoring important? Because the information helps us make decisions. So when you monitor, you look at your glucose levels, your blood pressure levels, you look at your food intake, your activity level, your lipid levels, your liver function, your kidney function, and then the other parameters that are important to keep checking on a yearly basis are your eye function, the condition of your teeth, and then the other thing you check daily is your feet. And then don't forget, you must keep your weight in check. So body mass index is also important. So these data points all help you make daily decisions about your diabetes, okay? So we'll make a point to share this even in the group, in the WhatsApp group. If you have not joined, kindly reach out to us so that you're in the group, so that when we share these numbers, what are the recommended levels for blood glucose, for blood pressure, for your lipids, you should know them. And you should always be able to make reference, because it's not always that when you ask in the clinics that you will be given these numbers. Now, numbers are not for judging you. They are information for making decisions. So you can make the decision to change your care, and we can also make the decision for necessary adjustment. Then the other important thing is choosing the right monitoring tool. When you're choosing the right monitoring tool, and especially for glucose testing, it will depend on your economic status often. So if you can't afford the gold standard, which is the continuous glucose monitoring monitors, then you can choose the blood glucose meters, okay? So selection should consider not only the cost, but the ease of use and your personal preference, okay? And then it is always important, once you choose what fits you, ask around, and often your care specialist, the doctor or the nurse at the clinic you attend, should be able to help you choose a machine that has local support. A lot of times we have people buying machines out there, and then unfortunately you come back, the strips are not available in Kenya. So please always make reference to your nurse or your doctor. And then secondly, you need to learn how to use the tool that you use. So the clinic specialists that you have will help you learn your machine and how to interpret the results, okay? When you're monitoring, and especially blood glucose, please do not focus on single reading. The focus is on the patterns. So let's say you're having high sugars in the morning and lower or better sugars in the evening. That's a pattern. But if when you're monitoring, maybe today you find only one sugar which is high, then that doesn't help. Often we can do what is called structured testing, where we ask you over a period of 3 days to check your blood glucose, and especially if you're type 2. And then we try to see what is the pattern. What does it tell us? The blood sugar in relation to the meals, is it morning highs? Is it midday highs or afternoon highs? Or if you're having lows, when are they occurring? Is it post-meal spikes? What is the effect of activity and meals? What is the effect of your sleep? You see? So all these things. And then if there are other stressors in your life, maybe you're going through a difficult time financially or in the office, this is also important to know, okay? So if, for example, if you had a low, you do excessive exercise, you're more likely to suffer from a low. So usually when we are looking at, especially at the single sugars, you need to look at what has been my life issues just before that sugar. It could be a pointer as to why the sugar is either low or high. So always remember that patterns tell the story. Numbers just give you a clue. So patterns are most critical, and that's the reason why CGMS, the continuous glucose monitoring systems, which Yvonne will talk about today, are very, very important. Now, when we look at blood glucose, which is what you will normally check, the A1C, the HbA1c, gives you average glucose over 3 months, which we would always like to be below 7, okay? Then when you do structured testing, when you measure your blood glucose 7 times a day, and usually we do a 3-day profile, it will give us trends and patterns, okay? And will give us a slight idea of about time in range. But when you come to CGMS, it not only shows you the time in range, it also shows you the trends and the patterns, and it also shows you the direction, whether your sugars are going up at that point or they're going down. And it helps you make real-time decisions. Then to sum it all up, there's some monitoring tips. If you're using a blood glucose meter, you really need to wash your hands before testing. You might have touched something that is sugary, and we don't want false readings. So ensure you wash your hands with soap and water and your hands are clean. And then the other thing, we don't want you to get infection, because if you prick and your hands are dirty, have germs on them, then you can get an infection. Ideally, you should test your blood glucose after meals, 2 hours after meals, to see the meal impact. If the interventions that you're doing and your medication is working, the impact should be seen when you eat. So fasting blood sugar is not usually very good for monitoring blood glucose. You can do 1 or 2 fastings a week, but the bulk of your blood sugar should be postprandial, meaning after meal sugars. Ideally, 2 hours after meal, but even if you can't do it 2 hours after meal, please note the time, how many hours after the meal that you do it. Then please, when you are sick, you need to monitor more closely, because you're more likely to go out of control when you're sick. Then life happens. When life happens, these are the times either it could be a positive excitement, very positive excitement. You see, like if you won the lottery today, it is not going to be a normal kind of happiness. If you're going to wed, it's not a normal kind of happiness. It's excessive happiness, sometimes often with stress. So when you're too happy, when you're too sad, see, maybe you're divorced, you have a land feud with your neighbor or with your relatives, exam time, when there's office politics, you are working in a toxic place, then those are periods when you need to monitor. So extremes of emotions are important to monitor. And when you monitor, it's always important to be very careful, especially when you go low. Low will kill you fast, more than even the high sugar. But extremes of sugars should be reported. If your blood sugar is consistently high above 10, then you need to report, Then also when your blood sugar, anytime you have readings below 3.9, it is important to report so that your medication can be adjusted. As you institute lifestyle change, you will notice that your blood glucose may start going down for some people, and for some people it can be very drastic. Kindly let us know, because you need to see your care provider quickly for adjustments to be made. And always remember, monitoring gives you data. That data must be brought to the clinic. So monitoring will help support your self-management. It helps you adjust your diet, exercise, medication, and any other self-care activity, and gives you it gives you the confidence and control that you require to manage diabetes on a daily basis. The other thing monitoring helps you is to set goals. When you know where you are at, you can set the goals for 3 months from now and a year. And then the other thing is monitoring helps you track your progress. You are changing your sleeping. You are changing your eating, your meal planning. You are changing your activity level. How do you find out whether this is having an effect or not? If you're not checking your blood glucose, if you're not checking your blood pressure to see the impact, if you're not checking your lipid levels to see how is my lipids changing in regards to the monitoring that I am doing. Now, critical, you can never feel the number. Some people say, oh, I feel this, I feel like this when it's low and it's high. Please, feelings can deceive, okay? So symptoms of high and low glucose can change or they can disappear. Especially if you have been in good control for long, you may not feel low glucose when it comes. So the only way is by verifying through checking, not guessing. So monitoring is important. So as a closing message, I just want us to remember, you are on a diabetes journey, just like a 10,000 kilometer drive on the road. It requires awareness, it requires adjustments, and it requires support. Monitoring is your dashboard. It keeps you informed, it keeps you safe, and it keeps you on the right path. So it is a very, very important part of your care as somebody living with diabetes. And I'd just like to leave you with 2 questions which you can answer as we go on. What is one monitoring habit that you will change starting today? And then secondly, which dashboard warning have you been ignoring? What warnings, maybe if you're monitoring, what warnings has your monitoring been showing you, but you have not taken action on? So if you can answer that in the chat, it would be helpful to see what the answers are and can propel us to more discussion. So thank you, and over to you, Lydia.
Well, thank you. Thank you so much, Dr. Jalang'o, Ms. Jalang'o, for that informative presentation. So Do you have a question in regards to monitoring your health? A question that Ms. Jalang'o can answer? All right. So maybe I can ask one. Well,
Yeah.
Ms. Jalang'o, over the seasons, we've had people who are living with diabetes. Some of them have really pricked their tips. They say sometimes I prick and blood doesn't come out, or fingertips are now disfigured because of pricking every day, 7 times a day. So what would you recommend?
Yeah, apart from your fingertips, you can use this place, that place for pricking. And then there are blood glucose machines that have a special pricker for pricking on the inside part of your arm. So those are other areas you can use to prick. So it's not always your fingers. And then if you can afford CGMS, then that's also another option. Because with the continuous glucose monitor, you stick it on behind your arm, and usually it sits there for 14 to 15 days, and you can read off the results using the monitor. Some CGMS have a monitor, others use an app which you can then get your results on your phone. Yeah, so that's your option. But it's my prayer that CGMS will become more affordable. You know, even blood glucose monitoring, when it came, it used to be so expensive to buy a blood glucose monitor. Now you can even get glucose monitors sometimes being offered pro bono by some of the companies, you know?
Yeah. All right. Well, now we know. Lucy Bome has a question. Please go
Yes,
ahead and
Lucy, go ahead.
all right, Lucy, go on. We can't hear you if you're saying something. All right. So maybe you could even try type your question in the chat. Seems like your microphone is not working. All right, all right. Okay. Choga. Sorry, Lucy. We can move on to Choga.
Okay, good evening.
Good evening.
Yes, I'm on CGM, and I've realized that if I eat carbohydrates, my sugars they rise up rapidly. I get my warnings of rapid rise. It can rise up to maybe 10 points, and then it falls rapidly again. Is that normal?
Yes and
So
no.
it's they're rising to from the normal level 5 points to 10 points and falling again to 5 points. It can happen in about 10 minutes or 15 minutes period. Is that
Yeah.
normal?
Yes, it is normal for some people and no for some others. Now, what would be helpful, Choga, is one, uh, can you note down those carbohydrates? You know, which carbohydrates are these? And then the other thing, look at how are they prepared. Then the third thing, are you eating that carbohydrate alone or not? Okay. For people living with diabetes, you'll also notice there are certain carbohydrates that raise your sugar very fast and very high. Those are called glucose triggers. And those are some of the things that, what do you call it, CGMS helps with. Now, when we notice that certain carbohydrates raise your blood glucose very high, the other thing we look at is how much are you eating at one particular time? Are you eating it alone? Are you eating it mixed with something, you know? Or what time did you eat it? Because all these have an impact on blood glucose. So basically, it will be a trial and error. We will make suggestions. You will try and follow them. And as you take up the initiatives that we'll be suggesting, we will be able to work out a plan for you that is tailored to your needs. Yeah, your body may be responding to some particular carbohydrates very violently, and that can be sorted by instituting a few things. The other trick sometimes is to make your carbohydrate the day before and refrigerate it, and then you warm it the next day. It tends to raise the blood glucose less. So there are many tricks. The other thing is to eat it with something with vinegar. The other thing is to eat it with something with fat or something with protein. So you need to work out that. And if it still raises your blood sugar, then that's a carbohydrate you probably will avoid or eat very little quantities of. Okay?
Maybe I can give you an example. It's like I came across information where it said you have to eat fiber, fat,
Yes.
protein, and then carbs at last. So normally I have salad, green vegetable mixed with carrots, cucumbers in the morning, early in the morning. Then around 8, I'll take 2 tablespoons of jungle oats. And as soon as I finish eating those 2 tablespoons jungle oats with peanut butter, I actually cook it. I don't just mix. I cook it on the fire and mix with peanut butter, but still it raises. Then it comes down rapidly. And meanwhile, when I'm not eating, it's normal. And when I eat my lunch, it's normally a feast size small grain with vegetables and a protein, but it goes up again and comes down. So
Then,
on those 2 occasions, on breakfast, after eating my porridge or after eating my kaza. So in a day, I'll have 2 triangles. In a day, I'll have 2 triangles in the morning and in the afternoon. I don't eat supper. Yes, I don't eat supper.
So you may have to think about changing that carbohydrate. We may need to try something. So what I would suggest, are you in the group? Are you in the WhatsApp group?
Yes, I am.
Yeah, so
I actually
let's
joined
connect.
today.
Great. So what we can do is let's work towards seeing your carb options and see what is the response to the various carbs that you eat so that we come with what works for you. Okay?
Okay, I will share with you my CGM records.
Excellent. Thank you.
Okay. Thank you so much.
Thank you for that. That was quite good.
Yeah,
Abby? Lucy, you're ready now? Abby? Yes? Can you hear her?
Not really.
We can't hear you, Lucy.
Can you hear me now?
Yes.
You can hear me?
Yes.
Yeah, I was saying.
Yes.
Mine is a bit worrying because since I was diagnosed with diabetes, I've been losing a lot of weight, so I don't understand what is happening. It is my first time also joining this program.
Yeah.
Yeah.
So what I would suggest is one, work on your numbers. Can you tell us your numbers, your blood glucose, your HbA1c? That's most critical at this point in regards to your weight. And then also your current weight, because that could be a pointer. When you're losing weight rapidly, often it means you're in bad control. Your control is not good. Or the other, that could be one of the greatest pointers usually. Because normally when you're put on medication, you should be gaining weight.
Yeah, but mine is losing.
Yeah, we need to work on that. Yeah, and then also look at your meal planning. And then if the weight is not bad, if your BMI comes to within normal, BMI, when we calculate your weight, divide by your height squared, if it's between 21 and 25, you've lost weight and your BMI is normal, then we are not worried. Yeah, but you also,
Okay.
I think sometimes it's the wow factor when you go out, and people are like, oh my God, you're so slim. Oh Lord, you've lost weight, And those those are the things that give us a lot of headaches.
Yes.
The
Yes.
people around us.
Somebody asked me. Yeah,
Mm.
somebody asked me that question. Why are you losing so much weight?
Yeah, and then then sometimes they roll their eyes like, a pointer to HIV. People don't understand, yeah. So you can imagine, oh yeah, some of the things that also derail our self-care is the people around us, the society. When you're improving your parameters,
Yeah.
especially weight, people are like, what could be happening with this one? So they're losing weight. And then sometimes people think you're being stressed, maybe if you're married by your spouse. So those are crazy. Yeah, those are some of the social perceptives and the stigmas that we have to live with.
Yeah.
Yeah. Okay. So thanks for sharing that.
Thank you too.
Mhm. Abby?
Yeah, we have another. Yeah.
Yes, I'm here. Thank you. Thank you, Dr. for this forum. Mine is wanted to ask what when people are saying that these natural remedies, these things like akina sijui ginger, turmeric, what? So like you'll hear some people saying that, oh, me, I'm taking those and it's helping. How are they?
Yeah, now one of these things is the thing is this, you need to, if you're taking something, the most critical thing is knowing what it is. Okay? Now,
Yes.
some things work, some don't. How do we know they work? You monitor. So the evidence lies in the numbers. So if it is working, HbA1c, 7. If it is for blood pressure is 90/60 to 130/80. Then yes, it's working.
Yes.
We can't rule them out totally. People are different. People have their choices. You can go herbal if you want. That's your choice. Nobody can force you not to. You see. So the most important thing, if it is working, we'll see it in the numbers. But most critical, always you need to know what is it that you are taking. How does it interact with any other medication that you may still be taking? Because that will be important, okay? And then what is the dose? Because sometimes people are boiling some roots and you're like, I mean, by the third boil, is anything in it anymore, you see. So there are some nice herbal preps that have doses. They're packaged in capsules or they're in tablet form. That's okay. It's up to you. If it works, we'll see in the numbers. So always you check whatever choice you have made to manage your condition. Check your numbers. If it's working, the numbers will speak for you. If it's not, the numbers also give the clue. Okay?
Okay. Thanks. One more. When you're combining like medications, I recently noticed that there must be a drug that I'm taking that has now made me develop some. Now the lower abdomen is growing bigger, but now I'm on several tablets, so I'm not able to eliminate or maybe even know whether it is the drugs or maybe it's age. I'm 55, so
Okay. So what we are going to do, we'll probably take that off the group because some of it may be as a result of cortisol. When you mention your age, yeah, it may be what is called a cortisol belly. Yeah, which is common that's around
yes.
menopause time. Yeah, so that would be also a factor related to cortisol. But even with cortisol belly, there are some of the things that we can do to downregulate cortisol, and that is things like sleeping, involving in activity that's not stressful, mainly aerobic exercise like walking regularly, and then sleeping adequately. Okay. Yeah, and then just
Yes, yes.
maintaining good emotional balance, okay? Stress management.
Okay.
So that one we can discuss
Thank
further.
you very much.
Okay, thank you very much, Abby, for the questions.
Okay, thank you. Appreciate it. Thank you.
Mm.
Thank you.
Okay, Lydia, back to you.
All right. Well, thank you so much for your participation, all of you. We have many more questions on the chat on YouTube. We promise to answer all those questions. We'll bring some of them to the group on WhatsApp, and then the others we can also answer them on YouTube and on Facebook. So please allow us to continue. Well, thank you so much, Dr. Jalang'o. Thank you for sharing your knowledge and experience. We truly appreciate. So many of us are familiar with the traditional way of checking our blood sugar. And notice I called it traditional. That is, you prick a finger and then provides a drop of blood and you use the glucometer to check your sugars. But technology is constantly evolving. And that is why we have Ms. Yvonne Kiarie with us today, our continuous glucose monitoring specialist. Well, she's the founder and director of Diabetes and OrthoCare Pharmaceuticals, DOP in short, and her mission is simple: to make CGM accessible, understandable, and impactful for every user. So as she presents this, I can see many questions on YouTube. What is CGM? How does it work? So Yvonne is here to take us through this. So please pay more than usual attention. And Ms. Kiarie, over to you.
Thanks so much for the kind introduction. So now I'll go ahead and share my screen. Let me know if you can see. Let me know if you can see my screen. Okay. Thank you so much, everybody, for joining and for being so attentive. I love the questions which you're asking about the blood sugar monitoring. So I'm sure this will be very, very, very enlightening for you. So that's my co-founder, Grace, and I would like to talk to you about the importance of blood glucose monitoring. Lydia, just confirm you can see the screen?
Yes, we can.
All right. So there are many reasons why you need to keep checking your blood glucose for those of us who are living with diabetes. And thank you, Dr. Jalang'o, for at least letting us know the statistics. So I know that this information is really very, very valuable to most of the people in the call. Yeah. So the first reason why we need to monitor our glucose is because we need to know how the food we're eating is impacting our glucose levels. So as somebody was saying, when they eat a high carb diet, they notice a spike. That is one of the things you really need to know. How do you respond to the different meals? You should be very clear how you respond to rice, how you respond to potato, how you respond to milk, how you respond to fruits, how you respond to all the carbohydrates, so that when you're making your food choices, you're very sure of how it's going to impact on your blood sugar. We also need to know about our blood sugar because of the medication that we're taking. So before you have your medication, for example, for those using insulin, though I didn't see any in the survey, but you need to know before you give yourself the dose of insulin, what your blood sugar is currently. And also, as Dr. Jalang'o has said, if you're using any medication, then you need to see whether using the medication is actually having an effect on your blood glucose, so that you can discuss with your doctor and be able to manage that condition very well. So you may need to titrate your medication upwards or downwards, but how will you know what you need to do if you don't know how your blood sugar is responding to your medication? The third reason we need to know about our blood glucose is because we need insight into how we are feeling. You get so many symptoms when you're living with diabetes. I've had people complain of headaches. I've had people complain of feeling weak, feeling dizzy, feeling faint. So when you have all these feelings, feeling very thirsty, you need to know what's going on. And so having a glucose monitor will help you know, are you feeling these symptoms because your sugar is too high? Or are you feeling these symptoms because your sugar is too low? Or are these symptoms nothing to do with your sugar because your sugar is normal and maybe you need to think of another cause? So it's really very important to give you insights into the symptoms that you may be facing. We also have personal safety to think of. So for those people who may have frequent hypoglycemia or very bad headaches when their sugars are high or low, then they need to consider what the level of their sugar is before they undertake driving or managing any heavy machinery. Or even walking. We've had cases of people collapsing in town because, they have had a low sugar. So it's really very important for your personal safety to always know what your glucose is at any one point. The same applies for when it comes to activities. So you want to go running, or you want to go swimming, or you want to go ride your bike, play sports, soccer, basketball, anything. You need to know before I set out on this evening walk, what's my sugar? And will I need to carry a snack for the way? Or will I, or what exactly will I require? So knowing your blood sugar will let you know what kind of activity you can engage in, for how long you can engage in it, and know if you really need to have a snack before you engage in the physical activity. This is especially important for people with type 1 diabetes and those using insulin. So traditionally, we have had the finger prick method, which I believe everybody on this call is familiar with. That is the one where you go ahead and prick your finger, and then you get some blood, and then you put that into the glucometer, and you're able to find your sugar readings. So this has been done many times, and I think we'll all follow the instructions which we got from Dr. Jalang'o about cleaning our hands to make sure that we get a good sample and get a correct reading. So this is good. However, it only gives you a snapshot of what is happening right now. There is also the inconvenience of pricking. I've had several people say they are not comfortable to carry their glucometer into the office, that they'd rather leave it in the car or go to the washroom to do this. So you may not be able to check your sugar anytime and as quickly as you wish, depending on the devices that you're using. So the finger prick method is still good, and it gives you a snapshot of what's going on at the moment. So I would now want to contrast by showing you what a continuous glucose monitor is and how it works. So this is a photo of a continuous glucose monitor, and you can see it is the white gadget on the arm displayed in the photo. Then we connect it with an app on your phone as she's holding, and the two of them will communicate by Bluetooth so that the readings coming from the sensor, the CGM, are displayed on your phone. So how does that work? So as I've said, a CGM is an advanced technology that allows continuous measuring of your glucose levels throughout the day and throughout the night. It consists of a small sensor which is inserted under the skin, and it measures the glucose levels in the interstitial fluid. The sensor then transmits this real-time glucose reading to the receiver on your smartphone or on a receiver. Some of the CGMs come with a receiver if you don't want to use the phone. So the CGM offers a comprehensive view of your glucose levels over time, capturing trends, patterns, and fluctuations. So this CGM is actually able to send a glucose reading of your current sugar every minute. So you don't need to check all the time, but when you need to see, you will just go to the phone, open the app, and your sugar will be displayed. So the CGMs are mainly made up of several components. We have the applicator, which is used to attach the sensor to your arm or your tummy. It comes with a sensor which is inbuilt to measure the blood glucose from the interstitial fluid and to send the data to the receiver. Then the third component is the phone, which now acts as a receiver to record the events and to even go ahead and generate analysis and reports. Because the CGM is sending a reading every minute, then the app will actually be able to pick all this data and generate some reports for you to review. So this is a diagrammatic example of what is happening. You can see that there's a glucose sensor which goes under the skin, and that is what is responsible for collecting the blood glucose reading. So this will actually stay in place for up to 15 days. So we have different sensors for between, some last for 14 days, 15 days, and we also have a 16-day sensor, depending on the brand and the manufacturer. So what is the benefit of having a CGM? The frequency of pricking will now be significantly reduced because you put the CGM on your arm, and then now you don't need to keep pricking yourself as you would with a glucometer. You'll also have real-time updates. As I said, sometimes you might want to check, but maybe you forgot your glucometer at home, or you don't want to do it in front of people, you're in a meeting, you're driving. So now this will make it much, much easier for you because you just get out your phone and check your glucose and make any decision that you need to make. Because the CGM is picking a reading every minute and uploading onto the app, the CGM will allow for trend analysis over time. So it will make some graphs, it will make some charts, just to help you understand how does your sugar behave in the morning before you have breakfast. Then it has the average of the 3 or 4 days you've been wearing it, or even the full 15 days, to tell you that your average sugar when you wake up maybe is 6. And then maybe your average sugar after dinner is always 11. So now we can have a good, more robust discussion with your clinician about how your blood sugar behaves and what we think is contributing to this. Then you can make an informed decision about your medication, about your diet, about your exercise, and even it can help you manage your stressors. A CGM also can have alarms for a high sugar and a low sugar, so that even if you're not checking your phone at that particular moment, if your sugar falls below 3.9 or whatever threshold you have agreed with your doctor to set, then it will ring and let you know that the sugar is going too low. If your CGM goes, if your sugar readings go above maybe 10, for example, then your phone will always beep or vibrate or ring to alert you that your sugar has actually gone high, so that you can do something about it. So in a nutshell, CGM will be very convenient because it reduces the need for frequent finger pricks and therefore is less invasive and more convenient than carrying around a glucometer. So this is an example just to show you the number of data points that you have when you're using a continuous glucose monitor versus when you're using a blood glucose monitor. So you can see for the blood glucose monitor, you only have maybe 8 data sets where you pricked and you got the reading. And you can see for all those 8 data sets, the person measuring their sugar is actually within the range inside the shaded box. However, if they did a continuous glucose monitor, then they have many more data sets, and you see there are actually times when they are above, and there are also times when they are extremely low. So all these have been missed out when they do the 8 data sets. And I think I will just continue with the analogy which Dr. Jalang'o had, that when you use a blood glucose monitor, it's like driving in the night and you have your lights off. However, you switch them on periodically where you know there are trouble spots. So you're driving home in the dark and you know there'll be a corner at a certain point. When you get to the corner, you switch on the lights, you navigate the corner. You know that there's gonna be a downhill or some bumps on the road. So when you get there, you switch on your lights and you're able to navigate the bumps. However, anything could have happened and things change throughout the day. A tree stump could have fallen, there could be an accident, there could be a pedestrian. So what we talk about a continuous glucose monitor is like just having your lights on throughout so that you're able to see all these unexpected things that could happen on your drive home. So thanks, Dr. Jalang'o, for starting that car analogy, because I think it helps me to explain better. So when you have a CGM, you'll be able to get different data points, and you'll be able to get a pattern of how your sugar behaves. Like you can see, the first one is a graph between 13th to 26th February and how the sugar has been behaving throughout that time. You also have a graph here, which is showing how your sugar bar graph, which is showing how your sugar behaves every 2 hours. So based on this, you can see that the person who was wearing this monitor between 20th and 26th February was only having their sugar less than 10 between 6 in the morning and midday. Thereafter, the sugars were very high. So when they have such a report, they can discuss with the doctor, and they will also know what could have happened to cause this pattern. And then you can work together to resolve such a pattern. There's also a new measure known as time in range, and the recommendation for anybody living with diabetes is that their time in range should be 71% and above. So time in range means that out of 100% of the time, how much of the time is your blood sugar under control? So you can see for this person, between 26th August and 23rd January, they had their time in range 71% of the time. They are actually controlling their blood sugar well. But you can see 21% of the time the sugar is between 10 and 13.3, and 13% of the time the sugar is very high. 8% of the time the sugar is very high, above 13.3%. So they can have a better, more robust discussion with their caregivers and with the doctors to resolve this issue. It will also let you know how many times your blood sugar has been low, what time it happened, and the frequency of the low blood sugar. So this data is actually very, very good, and you may not be able to catch up with such data when you're using the blood glucose monitoring as an option. So we recommend that you can choose CGM for enhanced blood glucose monitoring because it offers significant advantages over the finger prick method. Continuous glucose monitoring will let you have real-time glucose data, trends, alerts, and of course, great convenience. By choosing a continuous glucose monitor, you can have a better understanding of your blood glucose levels and make informed decisions regarding your diabetes management. If you would like to have a continuous glucose monitor, you can please speak to your healthcare providers or Dr. Jalang'o and the DTLC team, and they'll be able to connect you with us so that we can help you to have that. So there are some cautions about using the CGM. You should not have it in an MRI, and you should be well hydrated when you have it. Your Bluetooth should always be on. And for people taking blood thinners or on dialysis, then we need to consult your doctor before you go ahead to have the CGM. So we'll just end by saying the diabetes who knows the most lives the longest. So thank you so much for your kind attention. And I'll give it back to you, Lydia.
Thank you. Thank you so much, Yvonne, for that session, quite informative. Anyone who has a question, a burning question for Yvonne? We hope your questions have been answered regarding CGM, but is there a burning one? Okay, maybe I can ask on their behalf. Yvonne, how much is the CGM? Kenyan shillings, US dollars?
Okay, I think as Jalang'o was saying, when it comes to access, we are expecting the more people are using the CGMs, the better the price will be. But for now, if you come to us, we can get a CGM for 10,000 shillings. At least from 10,000 shillings, you'll be able to get a CGM for 15 days. Yes.
All right. Okay, so that's about 250 USD, right about there. Okay.
About $77. Or you're saying for the month? For the 2 weeks would be about $77.
Oh,
Yeah.
for the month would be twice that, right?
Yes.
All right, all right, all right. Oh, a question from Portia. Go ahead. Go ahead.
Portia? Yeah, thank you.
Can you hear me?
Yes, please.
Yeah, that was very nice explanation. Thank you very much. But I wanted to find out, you mentioned that it reduces the number of prickings or the number you perforate you perforate yourself. But do you have to prick yourself also to install it, or how is it installed? Is it like there's some glue on there, it just sticks on you, or does it have to go through your skin? Do you have to punch your skin?
Yeah. Yes, there is a little needle which will go in. It's a hair-like, very fine needle, so it doesn't hurt when you put it in, but you punch it in. So the action of wearing the CGM is like a rubber stamp. You press in, and it will stay. It will stay in for the 15 days. Yeah. So the needle will go under the skin and remain there for the 15 days.
So when you go to shower, you shower with it on?
Yes, you will shower, you can swim, you'll do all your usual activities. It is held very securely, it will not come out.
All right, thank you.
Yeah. Thank you, Portia, for that question. The point is no pain.
Yeah, only 2 pricks in a month, as compared to maybe if you were doing structured testing, 7 per day.
Mhm. Yeah. All right. So thank you so much, Yvonne, for that presentation. So would you like to purchase the CGM? Well, you can liaise with us. We'll put you into contact with Ms. Kiarie, and she's going to help you get one. So we want to say thank you so much. And of course, before we forget, it's time to put all that we have learned into action. Ms. Jalang'o, do we have a challenge for this week?
Yes, we have a challenge this week. We would like to know your numbers for the week. So Lydia will be sharing with you some sheets on the WhatsApp group. Kindly, if you have a glucose meter and you have access to blood pressure monitoring, please put in the numbers. It will be valuable for your progress. Yeah. And then, of course, in case you have any issues around monitoring, feel free to reach out to Lydia. She will connect you with one of our experts here. So please.
All right. Well, thank you so much. We are ready. We are equipped. We'll share with you the forms tomorrow, and then this will help you monitor your health and get to know your numbers. As we come to the end of today's session, let's take about half a minute to actually reflect on what we have learned. That diabetes management is not just about taking medication, it's about understanding your health and knowing your numbers. We've also learned that technology is changing the way we monitor, especially the way we monitor diabetes. We now have the CGM, helps us to see glucose patterns throughout the day and the night, and this can help us make meaningful decisions with our healthcare partner. I'd like to leave you with this quote from Maya Angelou. She says, "Do the best you can until you know better. Then when you know better, you do better." As we continue to learn more about diabetes, our numbers, our habits, our food, and our bodies, we become better equipped to do better for our health. So before we close, just a short reminder about our WhatsApp group. We want to remind participants in there, we look forward to receiving your food pictures. As we've mentioned earlier, these pictures will form part of our learning experience throughout the program. So they will help us discuss really resources, identify opportunities for improvement, and learn practical nutrition lessons together. So thank you so much for joining us. We keep learning, we keep monitoring, and we keep moving forward. Your numbers are information and not a life sentence. So see you again next week on Monday, same place and same